এখন আমি এসেছি চেন্নাইয়ের অ্যাপোলো হাসপাতালে। এখানে রিউমাটোলজি বিশেষজ্ঞ ডক্টর এস রামাকৃষ্ণন স্যারের সাথে আলোচনা করব। নমস্তে স্যার।
Namaste.
Sir, what is the symptom of rheumatoid arthritis?
The symptoms of rheumatoid arthritis are pain in the smaller joints of the fingers,
Okay,
then the wrist,
okay,
the knees, the ankles, and the smaller joints of the toes.
okay,
This is associated with swelling of the joint and difficulty in joint movement. And they have typically, classically, early morning joint stiffness.
early morning stiffness.
Early morning.
Okay, and how it is differ from osteoarthritis?
See, rheumatoid arthritis is multiple joint affected.
Okay,
Osteoarthritis is single joint affected, like mainly in the knees.
okay,
Rheumatoid arthritis is an inflammatory arthritis where the joints will be swollen, warm and tender,
okay,
with movement painful. Whereas osteoarthritis is a degenerative disease.
okay,
The cartilage, what we call it as a shock absorber, gets
Okay.
worn out, so the two bones get into friction, so there is pain. Osteoarthritis typically affects the knees. People
Okay.
have difficulty in standing up from the squatting posture and walking on the floor,
Okay.
and walking stairs, upstairs and downstairs.
What is the main cause of this rheumatoid arthritis?
The main cause of the rheumatoid arthritis is like this. We have a defense system in the body which is responsible for fighting any infection inside.
Okay,
Unfortunately, in rheumatoid arthritis, the body's defense system starts identifying the joint as an enemy and it starts fighting against the joint. In this process, lot of missiles are fired into the joint. With the
Okay.
result, the joint gets inflamed, it becomes swollen. So it is called an autoimmune disease. Immunity means defense, auto means self. So it is against self, the defense system starts acting.
okay. So what are the treatment option now for this against rheumatoid arthritis?
Now the treatment for rheumatoid arthritis depends on two things. One, we give painkillers which can be either steroids or anti-inflammatory drugs like ibuprofen, ketoprofen, diclofenac sodium, etc.
Okay.
They will control the inflammation.
Okay.
On the other side, we have the disease-modifying anti-rheumatic drugs which basically act on the basic disease process. These drugs are hydroxychloroquine, methotrexate, leflunomide, etc. In addition to that, now we have wonderful drugs available called biologics.
Okay.
These biologics are very potent medications for treating rheumatoid arthritis.
Okay.
They act basically on the nature of the disease, specifically at the disease affected joint.
Okay.
So biologics are now wonderful drugs which we give and make patients all right. All biologics are available in India at a nominal price.
Okay. Sir, physiotherapy or exercise can reduce the pain of our patients?
You are perfectly right.
Okay.
Physiotherapy is very, very important supplementary therapy in patients with rheumatoid arthritis.
Okay.
Physiotherapy, what it does is, it makes the joint more mobile. It decreases the joint swelling. It decreases the joint pain. And because of physiotherapy, the muscles also will become very strong.
Okay.
So physiotherapy, all patients with rheumatoid arthritis must go in for a physiotherapy program.
Okay. And is there any link between the diet of the patient to the rheumatoid control of the RA pain?
See, diet does not play a role in the causation of rheumatoid arthritis.
Okay.
And there is no dietary intervention in people with rheumatoid arthritis.
Okay.
But one important point, all patients with rheumatoid arthritis should eat a good nutritious food with plenty of green leafy vegetables and fruits. They can take milk, they can take curd, etc.
Okay.
They have to take adequate nutrition because they are taking medications which can cause gastritis, so should they never fast.
Okay. And stress, we all are people are now stressed. So any relation for the stress is related to RA positive patients?
That's a very good question. Stress is when mental tension. बहुत
Okay.
चिंता हो रहा है.
हाँ, yes.
So इस problem में क्या हो रहा है? बहुत tension ज़्यादा हो रहा है. When the mental tension increases, it gets reflected in the joint and the
Okay.
joint will flare up.
Yes.
Certain people due to sheer tension can develop joint pain in the joints without swelling.
It is stress is very much
Very
related.
important. That is
Okay.
why we ask these people to get into yoga, transcendental meditation, pranayam, breathing exercises, etc.
That will reduce to help of
That
the
will
pain.
reduce to help the stress, and the stress reduce, the joint pain will decrease.
And some people are have pains but they ignore. So early detection of the disease can be very useful for the patients.
Wonderful question.
Okay.
The earlier you detect rheumatoid arthritis and the earlier you start treatment, the best is for the patient.
Okay.
So what we tell is start treating rheumatoid arthritis early after making the diagnosis early.
Okay. So if anybody has the pain of the joint pain, what test you prescribe to them?
I prescribe the test usually blood counts Then I prescribe the ESR.
Okay.
Then I prescribe the rheumatoid factor and the anti-CCP and the C-reactive protein.
C-reactive protein.
Rheumatoid factor and anti-CCP are specific for the diagnosis of rheumatoid arthritis. 70% of patients with rheumatoid will be positive for rheumatoid factor and anti-CCP.
Okay. And it is a genetic problem. If any father or mother affected with rheumatoid arthritis, it can be transferred to their children.
That is a chance. They say it's hereditary, but the chance is very meager. It is less than 1%.
Or less than 1%.
So people needn't get worried. Just because I have rheumatoid arthritis, it does not mean all my children will develop rheumatoid arthritis. Only less than 0.1% risk is there. So if, nothing to get worried.
So if anyone father or mother affected, it does not now necessary till the symptom to check the anti-CCP or other factor for the children.
No need to do any blood tests for children or any other person relative of rheumatoid arthritis patient.
Until
they have symptoms of pain in the joint, swelling in the joint, warmth in the joint, movement in joint difficulty with early morning joint stiffness. Please do not do the test for rheumatoid factor and anti-CCP unnecessarily. You will only get tensed after seeing the result.
Some people are worrying when they are affected with rheumatoid arthritis that when they will be able to 60 plus or 65 plus, they can be able to work, they can even able to work in the room also. It is the myth or there is a treatment that they can...
It is a myth. If you diagnose rheumatoid arthritis early and treat the rheumatoid arthritis with specific disease modifying drugs or biologics, the patient's life will be absolutely normal like another person who does not have rheumatoid arthritis. Very important, patients should immediately see the rheumatologist if they develop pain in the joint and swelling in the joint and get the disease treated very early. So early detection is the most important according to you? Early detection, that is early suspicion, early detection, early treatment, early physiotherapy and dietary modification will make the rheumatoid arthritis patient absolutely normal. And be cool and calm, with stress free with the meditation. Be cool and calm, just meditate a lot, do pranayam and don't get worried about the disease. There are doctors are there, enough rheumatologists are available, enough medications are there, cheaper medications are available in India. What treatment is available for rheumatology in the world is available in India. We must be proud of that. Whatever the latest treatment is available, it is available in India. Available in India. So just thing they have to do, they don't delay of the treatment. Don't delay the treatment. Whether there is symptom, go for the check and take advice from the rheumatologist. Very good. Perfectly correct. That is what they should do. Thank you. Thank you. Thank you very much.